How's it, guys, and welcome back to my channel. My name is James, and today we will be discussing how to perform an easy RSI. There is no such thing. Really, there is no easy way to do an RSI. We should not approach one of these with the mindset of, well, this one looks easy, this one should be easy, or we get overconfident and think that it'll just go as planned. We should be prepared for the unexpected, because if we're ready for it, then, well, we're ready for it. So the ways that I move into, or the ways I approach this and things that I do that really help me with my intubations is, well, for one, it's being prepared. You need to be prepared, and the patient needs to be prepared. If you know what you're going to do, if you have all the stuff you're going to need, you'll be okay. If the patient is also prepared, meaning they're being pre-oxygenated, it means they're in the right position, which will be number two. If they are just all the things are ready, you have a whole lot high chance of being successful. Position is super important. If you just put their head up 20 to 30 degrees, I'll drop an article on the bottom that explains all this, and their face is flat with the roof, this gives us a much better chance of intubation. It also makes it much easier for us, because then we don't have to be crouching down trying to do this. We can be sitting up straight and we can have a comfortable position, and this allows us to be much more easier to intubate. The other benefits of having their head up 20 to 30 degrees is that, for one, we remove passive regurgitation, because obviously the gravity pulls down whatever fluid's in the stomach. And the other one is that the lungs ventilate better. So when they're sitting up, there's less pressure from their chest on their lungs so that their lungs can expand more, and they actually oxygenate and denitrogenate much better. And then finally, no-desat and pre-oxygenation are just fundamentals of an RSI. So what that means is that, and I hope you guys have heard about this and I'm just repeating it. So what that means is that we put a non-rebreather mask. We put a non-rebreather mask and a nasal cannula, and what this does is it increases the positive pressure in the airway, and that causes more oxygen to get into the lungs. So this pre-oxygenates. So this flushes all the carbon dioxide out of the lungs and it fills it with oxygen. This is also denitrogenates. It removes all the nitrogen from the lungs. So this means that now that we have pre-oxygenated, and so there's so much oxygen in all the hemoglobin, and we've removed all of the carbon dioxide, that even once we are intubating, the air that is in the lungs is full of oxygen, so more than 21% oxygen, and we're trying to remove the other like 70% of nitrogen. This helps so that when they are apneic, that the movement of CO2 is coming out and the movement of O2 is moving in, and this helps the patient stay oxygenated for longer. The nasal cannulas that are at 15 liters also stay in the nose, and this is no-desat. I'll also drop a link to this. This has been going on for a long time. And what this does is that this adds a positive pressure into the back of the airway. And so when the patient is apneic, there is a passive movement of oxygen into their lungs, and this keeps them oxygenated. So they have done studies where they take healthy individuals and they put the nasal cannula on their nose, give them 15 liters per minute, and they paralyze them. And they didn't go hypoxic for like 15 or 20 minutes with no breathing. Yes, they were profoundly hypercapnic and obviously had to ventilate them, and their pH dropped, which is obviously going to happen with a rise in CO2, but their O2 never dropped, so they never became hypoxic. That's amazing. So we leave nasal prongs on at 15 liters per minute, even while we have paralyzed them. And this is no-desat. I'll drop a journal to the bottom there that you can look at. This has been going on for a long time. I'm sure you've heard about it. I'm just repeating it. So that is pretty much the science behind that. The reason why the O2 in the nose going into the lungs works is actually because the lungs absorb more O2 than they give off CO2. And this actually causes a negative pressure in the lungs, or in the alveoli, and that actually draws oxygen into the lungs. So there's this passive ventilation, well, passive oxygenation, not ventilation. Obviously, because there's no CO2 coming out, it's only O2 going in, it's only oxygenation. The other one being a bougie. We need to approach an intubation with a bougie. There is just so much research saying that bougies are the right way to go. We really cannot be approaching an RSI and not be using a bougie. It makes it easier, it makes it quicker. The consequence of having to try and intubate twice, the consequence of having to ventilate, the consequence of aspiration all increase when we don't get first pass success, and Bougie's increase first pass success, even in novice providers. So especially if you're just coming into this new and you're just learning and you're like about to do your first RSI, or you're a year away from being an individual practitioner, you need to be able to use a Bougie. From very early on, I said to myself, every intubation I do, I will intubate with a Bougie, especially if it's an RSI. It just definitely increases your chances of first pass success. And I will link some journals to the bottom here which show you how a Bougie increases first pass success. And then I'll add another journal which discusses how when we don't get the tube in on the first pass, we have increase in aspiration, we have increase in hypoxic brain injuries, and these are all really not beneficial. I hope that answers it, that there is no easy way to do an RSI. We cannot move into thinking an RSI will be easy, because that is when we make mistakes. And we're dealing with people's lives. We have people's lives in our hands. We paralyze them. We are responsible for their breathing. We need to realize that if we don't go into this with the best chance, then really we cannot, or we shouldn't be doing what we're doing if we're not doing what is best for the patient. It's always about the patient. Guys, hope you enjoyed this. Please hit like and subscribe. If you have any comments or questions or queries, drop them below and I'll probably reply to every single one of them, and you'll see you in the next video. Bye for now.